women use light differently than men. And the key thing is, once y'all realize it, then you begin to say, this is the reason why we need to do things a little bit differently.
Tell people about, step into the future with the Quant device that you created.
Well, it goes back to the original thing that we talked about in podcasts. I realized with Ruben about 2 years ago that all this biophysics data of how light, water, and magnetism comes together. It's kind of like what you had asked me before we came on the podcast. How do we make this really simple for people without, trying to change their entire existence? So I said to Ruben, I said, what if we created another eye? And he looked at me. This happened right on my porch out here.
With a bottle of wine.
No, there was no wine this time. It was actually in the middle of a thunderstorm. And we had the GDV camera out because he wanted to see the difference in the local environment when a huge storm was coming through. And I said to him, I said, Ruben, if we build an eye somewhere on the body, we can actually deliver light frequencies that we're missing. So remember what we said earlier. We're missing purple and we're missing red. I said, what if we make a device over an imperfect black box radiator? What does that mean? Our pupil is a perfect black box radiator in physics. That means it allows light in and allows the light out. That's why it works so well with the sun. That's how we get the light energies into our brain to do the things that it does. I said, if we look somewhere on the body and we find a perfect, or I should say an imperfect black box radiator, what does that mean? It means that we're looking for an arterial cascade that meets a venous cascade so that there's a big change of arterial and venous blood that we want to load with light frequencies, and we want to use cold to do it. Why? What I told you before about the leaf and my wife in the pool. When you cool a surface, you absorb more UV and more IR light. So I got the idea, actually reading some data from Harvard University and Stanford University. About 6-7 years ago, they came up with this thing for athletes, high-performance athletes, which was called the Stanford glove. And it was this big, huge glove that went on the hand, and it had a vacuum pull device, that pulled the surface blood vessels up, and they were actually able to cool it, and they would cool their body down. They found that their athletic performance went up tremendously. Just by doing this alone, they started using it with athletes. The problem was, when these guys work out, you can't wear this huge thing on your hand. So they were losing the benefit. So I had been thinking about all the things I was doing with the leptin prescription and cold thermogenesis. And I said, the thing that these guys are forgetting? What's the thing that pulls blood vessels up to the surface best?
Nice.
UV light. Sunlight. I said, why don't we just introduce specific light frequencies over the radial artery, which is an artery every doctor and I think every patient knows because that's where we check your pulse. Anybody can feel it now. Well, it turns out this has something that's also really beneficial that anesthesiologists use anytime you put someone to sleep. We put this little red thing on your finger called a pulse oximeter, and that tells us how much oxygen is in the blood. So I explained to Ruben, the more UV and IR light we get in the blood, the higher the oxygen level goes up. You technically don't need lungs to breathe. You can actually use light to breathe. And he looked at me like I was crazy, and I gave him all the data about it. And he goes, let me get this straight. You think that we can cool the radial artery and put UV and IR light through it to act just like our eye? I said, it won't be just like our eye, but it's going to be awfully good. And that's what we did. We came up with the Quant device, and it's the first quantum wearable device. And it was designed 12 feet from where I am right now in the middle of a thunderstorm utilizing a GDV camera. And we came up with different iterations of it. It's, out now. You can actually go to our Indiegogo page. Our goal, if we were to make this and sell it, like say in Walmart, it would probably cost $5,000, $6,000, $7,000 to make. We decided to go with a crowdfunding thing because our goal is to try to get it in everybody's hands. And we think if we can meet our initial goal, that we can sell it for probably between $400 and $600.
That'd be amazing.
Well, not only that, it'll probably be the first wearable device that won't kill you, like the Fitbit or the iWatch or, a cell phone, because what we're doing is we're putting energy back into your body while your environment is sucking it out.
Right.
And as long as you use these and your skin and your gut and your lungs to do the right things with this may be able to offset a lot of our progress or luxury beliefs that we have now. And Ruben has been biohacking this huge. He's a CEO of a company in Germany, and he flies back and forth to from Boston to Germany 2 or 3 times a month. He has worn the Quantlet since we've designed it. He's not got any jet lag when he flies. And the thing is, when you understand what we said before, I told you about light, dopamine, melatonin. How do you get jet lag? Melatonin drops. Well, what did I tell you? If I can add back UV and IR light, I can stimulate the repair programs to make melatonin, can I? Well, guess what? That's what the Quantlet does when he's flying. And that's the reason he doesn't get a circadian mismatch when he gets there. And that's the counterintuitive thing. Most people, Anna, especially in the anti-aging meetings that we go to, most people think that melatonin is a pill answer or it's an answer for the pineal gland. It turns out that's not true. The RPE of the eye is what makes melatonin. You have to make melatonin in your eye before it can work in the pineal gland. And see, that's the details that people miss.
But when we're in the interim, as we're healing the processes, sublingual melatonin, you think it's not?
I got a blog coming about that very soon. If you take melatonin exogenously, you are destroying the endogenous clock. You never want to take melatonin. And very rarely will you hear me say, never or not. And now this is specifically for you. You know that another biogenic amine is dopamine. What do you know about dopamine when we use it as doctors? We give L-Dopa to people, and what happens? It only works for about a year and a half before they get off symptoms, right? So then they have to have deep brain stimulation because the medicine doesn't work. The same thing happens to melatonin, except it's not as obvious. So it destroys endogenous signaling. And the reason for that, if you really want to know the reasons why this happens, I wrote a blog, and it's very detailed. It's called Time 6. It tells you exactly the reason and how this happens. It turns out that there's a chemical in our body called glutathione. Glutathione is designed to work with UV light and dopamine, and glutathione quenches, and when I say quench, we're now talking about a photoelectric effect, quenches the effect, and it's quantized to the amount of light that comes through the eye. And the problem is all these people that have this disease are getting constant source blue, no UV. And that's the reason why the medications don't work. When you begin to understand how all this complex physics works through the eye, that's when you start to go, you look at our profession and go, man, this explains why these medicines don't work. And this explains why, I'll give you a perfect example. I said this earlier, and I know that you are a big proponent of bioidentical hormones, and you know that there's many people who do anti-aging medicine that talk about putting bioidentical hormones on their skin. If you listen to what I said earlier, you would know that UV light completely inactivates bioidentical hormones that are on the skin. So guess what? If you put it on, you better make sure it's covered. Otherwise, it ain't going to work. Okay? Most people never get told that.
Right.
Never. And that's the reason why they have to take ridiculous amounts, because people don't understand how light and hormones work.
It adds to why it works better when it's applied around the vulva, the inner thighs, the lower belly.
Yeah, most women are not cruising around with that hanging out.
No,
Exactly.
no. But intermittent melatonin for, intermittent even, you're saying tiny doses of sublingual. Because what about the melatonin research to help with autoimmunity and breast cancer?
Very simple, because it's low. So when they give it, they're getting a benefit. Here's the problem that you're not realizing, timescales. See, all studies are done on short timescales. What are we interested in? We're interested in on a 50, 60, 70-year window. If you lower, your endogenous production, what's going to happen? I'm going to get even more controversial probably in the next 6 weeks on my blog when I talk about vitamin D supplementation. If you've ever sat down, you think I'm controversial now, wait till you read that. Can you supplement the sun? The answer is no, you can't. And you shouldn't. Guess what? Taking vitamin D has a time and place, but for most people, it's the wrong thing to do. And I'm going to explain to people why it's the wrong thing to do. And I know this is going to shock people when they hear it, but when you understand, and I'll explain it to you very simply here, because I think you'll get it and your listeners will get it. What is vitamin D3 in our body? It is the chemical signal after a light has collided with proteins in us. What does that mean? The chemical signal is only designed to be present when the photonic energy has been absorbed by our atomic lattice. So when you take vitamin D, you have the chemical, but you don't have any of the light power in your body. You think that's a good idea? Is that how you would design by nature? No, not at all. And does that have effects down the pike? The answer is yes, it does. So I'm okay when the doctor understands what I just said, when someone comes in, say with an autoimmune condition, but I got to get the patient to understand, we can do this temporarily to turn your immune system on and this and that, but you have to stop doing this and you have to start doing this. And if you don't do it, I'm not taking care of you. And I explain this to them, just like we talked about in this podcast.
Yeah.
I explain it to them in detail. And the other thing I explain to them, because people don't really understand light. When sunlight hits us, we make cortisol, we make vitamin D3. Guess what else we make? We make another chemical that gets cleaved from this protein in our brain called beta endorphin. Most people know about it from runner's high. Well, guess what? That's why the sun makes us happy. And see, it comes from a chemical in the eye that gets made in the brain in the hypothalamus called POMC, and it's called POMC, okay? There's about 6 cleavage chemicals that are made. One of them is beta endorphin, another one is cortisol, another one is ACTH, another one is alpha MSH. And that's the reason why people who have Lyme disease, autoimmune conditions, always have low alpha MSH levels. They always have low beta endorphin levels. That's why they always feel like shit, because they can never make these things, and it's why all autoimmune conditions are always associated with low vitamin D levels.
Well, and that brings me to something, I'm so passionate about, the oxytocin hormone. So we're talking about that delicate balance, like we're unable to synthesize oxytocin in this milieu. And
Correct.
So we have PTSD harder, longer, and then the effects of chronic adrenal dysfunction, right, of the cortisol imbalance, creating that leaky membrane. That leaky membrane, if it's in the gut, if it's in the endothelium, if it's in the cardiovascular, if it's in the brain, the impaired integrity of the cell membrane.
That's one of the effects for sure. The easier way for people to think about it is that the signal through the eye is broken, so that means the paraventricular nucleus is constantly outputting. So just think about it like this. You have a circuit that's working like nuts, it's going to eventually burn out. What's the thing that balances that circuit? Is the vagal system. That's the parasympathetic. So what you have to realize is the parasympathetic gets completely turned off. What turns it on? UV and IR light. See, the parasympathetic and sympathetic system, the way you and I learned it, I personally think is psychotic because it doesn't make any sense. But what does make sense, this is how I break it down for people. Even if you don't know anything about light, you've probably heard physicists talk that light has 2 parts. It has a duality. It's a particle and a wave. Do you know fundamentally what the paraventricular nucleus and the vagus system does? One acts more on the particle side of light. The other one acts more on the wave side. In fact, I even told you this when we talked on the phone a couple of days ago, that's the main difference between men and women. Women are designed to work with both parts of the duality of life because you're the ones that allow life to form inside you. Men don't need both parts of light. Therefore, the atomic lattice in men are different than the atomic lattice in women. And if you really want to know why women go through menopause, is because when they go through menopause, they're reducing the amount of the particle aspect of light they use. Why? Just think about it common sense wise. If you are designed to come out your mama and work on both sides of light, that circuit is hot. It's always hot because you need the extra juice to give it to a baby. Well, guess what? If you kept living your life with all this extra juice, you would burn out like a blue straggler star. Instead, nature wants you to be more like a red giant. And what's a red giant? Red light works better on the wave part of light. Why? Because it works with water. Now I want you to think, Anna, about what I just said. What does your mitochondria release? It releases infrared light. And see, that is the key. See, that's the reason why young women have nice breasts and nice behinds, because what they don't realize is that's where they store their DHA. DHA is the chemical that turns light into an electric current. And that's the reason why men are drawn to women with big boobs and nice behinds, because nature tells the man that she's going to be able to make a baby with a big brain, and a brain that works, that can make dopamine, melatonin, melanin, and all the biogenic amines we talked about. But
you can add the shiny hair onto that one too, the other trigger.
There's no question about it. All these things tell us that you are a lightning rod for sunlight. Now, no man, I know when I talk about this with my wife and her friends, she hates that I can break sex down just like this, and it even gets deeper. Even if we talked about different sexual proclivities and how it fundamentally works, would blow your mind. And I kid you not, but it's all photoelectric power. Women use light differently than men. And the key thing is, once y'all realize it, then you begin to say, this is the reason why we need to do things a little bit differently. And until doctors, especially anti-aging doctors and OBGYNs, really understand how women differ with the use of light and water, we're not really going to solve ladies' problems. And that's part of the reason why I believe if I can teach ladies about light and water, they're going to be far along in the game. The key thing is finding a doctor like you who actually is not going to dismiss them and throw them out of the office and say, well, you're batshit crazy. Because it's not crazy. The thing is, women can get back what they've lost. They need to understand they are designed by nature differently for a reason. And when you understand what that reason is and why your life changes, I would tell every woman when they get off, listen to this podcast, go pull your pictures out when you're 18, 28, 38, 48, and 58. And if you got any of your boobs and your butt, really look at them. You know what you're going to notice? There's a huge change there. And all of you get pissed off about it, and you shouldn't. Why? Because you don't need big boobs anymore. You don't need, an ass that looks like a Brazilian dancer, but you want it. And that's why the plastic surgeons are happy you want it. They'll put fake stuff in you. You need to realize that your body is depleting its DHA for a reason. Every time you have a child, you are designed to deplete. Then you have to replete, okay? This is the reason why autistic babies happen much more frequently these days, because women are depleted and never get repleted. And they live in an alien sun world in non-native EMF. They don't understand that non-native EMF and blue light destroy DHA levels. Not only in your boobs, not only in your butt, but guess where? Here. And
right.
Here's the take home. What is the one tissue in the body that has more DHA than any other? The retinal pigmentum epithelium that works with what? Sunlight.
This episode of the show is sponsored by Julva. Julva is an all-natural anti-aging cosmetic cream for your delicate feminine parts, created by triple board certified OBGYN Dr. Anna Cabeca. If you want to stop embarrassing urine leaks, reduce vaginal discomfort and dryness, and reignite your intimate relationship, try Julva today at dranna.com and use the code SHOW10 to get 10% off your first order.
That's how it works.
Well, and that whole, we mentioned autism, and then that connection with the microbiome also responding to our light and our electromagnetic and our water.
Yeah,
right?
But people don't understand how the microbiome fundamentally works with light, and we can get into it a little bit. You have to know a little bit about a research.
I want to go back to the differences between men and women, because you started it.
That's another podcast, because that is
we'll do it.
You have to know a little bit more about light and water. And this is what I will tell you. If your listeners and you go out and buy these two books and assimilate them before I come back on, then you're going to understand why they are different. The name of the first book I've told you is Gerald Pollack, The Fourth Phase of Water.
Yes.
The second book is written by a guy named Roland Van Wyck. You spell his first name Roeland, Van, V-A-N, Wyck, W-I-J-K. His book is called Light Sculpting Life. That's pretty much everything you need to know about light, and Pollock's book is everything you need about water. You need to know a couple more things, but I can cover that in the podcast. When it comes to the microbiome, no one in medicine has a clue how it works, but I can give it to you very simply. Fritz Popp was a physicist in the 60s, 70s, and 80s, and one of the things that he became famous at is he proved what the Russians found in 1923, that every single cell on this planet emits extreme low-frequency UV light. That's actually the stimulus to mitosis. Here's the key thing. Eukaryotes, which we are, and this may be over the head of some of your listeners, but it's important for you to hear because you can probably dissect this out from them further. Eukaryotes are the most complex portions of life. That all eukaryotes showed up on planet Earth 580 million years ago in an event called the Cambrian explosion. It happened literally within 30 million years. Every bit of life that's on the planet right now started then. The only two kingdoms that were present before us were archaea and bacteria, which are called prokaryotes. Here's where it gets interesting. Your microbiome is made out of prokaryotes. What's the big difference between prokaryotes and us? They don't have mitochondria. We do. And here's the key thing. They release 5,000 times more light than a eukaryotic cell. Our cell is designed to contain them. Why? All our cell membranes are loaded with what? DHA. Prokaryotes don't have any DHA. So you know what that means? Bacteria are killed by UV light, and we are able to use the photoelectric effect. That's the key differentiating point. So when you understand that we have between, depending on who you believe, between 100 million to a trillion or 100 trillion microbiome cells or bacteria in our gut, what does that mean? When you eat, what did I say to you before about sunlight on your skin? That sunlight on your skin brings the blood to the surface because of nitric oxide. Light draws things. So when you eat, you're delivering electrons to those bacteria. What do? They begin to release light. What's the inside of your gut? It's a lumen filled with eukaryotic cell membranes that have what? DHA. It turns the light from the microbiome in from a photonic signal to a DC electric current. DC electric current sits right next to what, Anna? The GALT, the gut-associated lymphatic tissue, the biggest immune organ in the body. Want to know where autoimmune disease starts? It starts from an unyoking of UV and IR light here and here. You can't fix an autoimmune condition with food. You got to fix it here. Okay? These two things work together. Why? Think about what you learned in medical school. When you eat, what happens? Peristalsis stops. These don't release any light. So what happens when you're watching the idiot box at night, getting blue light through your eye, and then you start snacking on crackers and chips? You just turned on the signal here with no UV light here. It's the perfect mix. What did you just do? You caused a circadian mismatch of T regulator cells in your gut that control both arms of immunity. That is how you make autoimmune disease. Anyone you want to, figure out, it just depends on which mitochondria you destroy in that tissue. How do you destroy mitochondria? What I told you before, the heteroplasmy in that tissue. So if it's in the thyroid, you get Hashimoto's. If it's in your brain at the aquaporphyrin gate, you get MS. If it happens to be at a protein in your collagen called MMP9, you get rheumatoid arthritis. Everything is a circadian mismatch. Everything is related to light. And the problem is nobody understands it.
And then the reversal of it for all of those conditions comes down to the same thing.
Well, you have to change the environment that you've allowed. In other words, when I teach you how to mind your mitochondria, it's going to start with your eye. Then it's going to go to your skin. And the last thing you're going to get right is your gut and your lungs. See, those are the four main surfaces that we're designed to work with. I always tell my members that we are basically a Con Edison light bulb by nature. And you have to understand that the frequencies that we use during the day are blue, green, and red. Okay? The ones that we regenerate with are UV and red. If you just think about just the basics of that alone and think about what your doctors have taught you, they've taught you to fear UV light. And that's the reason why we're getting sick. Not only that, when Tesla and Westinghouse electrified the planet in 1893 at the Chicago World's Fair, I'll challenge anybody to go back and pull out any data you want to see, and you want to know when all Neolithic diseases spiked, that's it. Because, I've had some of my members say to me, hey, doc, MS was clearly present in 1832 before all this. I'm like, yeah. Did the ladies have clothes on? Because clothes will cause a mismatch. It'll take longer to get there, but you'll still get there. The problem is now it's fast forwarded. This is the reason why. Before your mom died, if you would have asked your mom, do you remember seeing all these people with Alzheimer's and Parkinson's when she was a little girl? You never saw it. I'll tell you a funny story about my residency. When I was at LSU, we have a big a hospital down here called Ochsner. That's kind of known as the Mayo Clinic of the South. And J.O., who is his son, Big Ochsner's son, was a cardiovascular surgeon. And his dad was still alive when I was like a first or second year resident. He says, come on, Jack, I want you to introduce you to my dad. I got to meet the original Ochsner, Alton Ochsner. And he told me the story that he brought medical students in the 1920s to see cases of lung cancer because you may never see these again. That's how rare they are. So when he told me that, I went back and looked in the archives of where I did my residency, which is a charity hospital, which is now closed. We had the best medical records going back to the 1850s. I found out that in 1900, that colon cancer was the 37th leading cause of cancer. Today, it's number 2. So if you believe what the oncologists are telling you, that genetics cause cancer, tell me how in five generations that we went from 37 to 2. You know what happened in the same time? Tesla and Westinghouse made the electric circuit. And then we started to turn DC current to AC current. AC current is one of the worst things you can do. Why? Around me right now, that electric power grid oscillates at 60 hertz. You can Google that and see. You know what your mitochondrial membrane oscillates at? 100 hertz. So that is a resonance frequency problem, okay? Just think about it like this. For people who don't understand physics, think about the old days when you drove your car on an AM radio underneath the power line and you heard that. That's exactly the same effect. Why is this a big deal for Europeans? Their power grid is 50 hertz. That means they're more at risk because of the way our mitochondria are built. That's part of the reason why, if you look at Scandinavia, they have more obesity, more autoimmunity, and more type 2 diabetes than almost any other place on the planet. And the interesting thing with all of these things is if you look at cancer, autoimmunity, and obesity, the further you get away from the equator, they all get worse. It's not just MS. Everybody in medicine knows it's MS. It's all of them. Why? What does vitamin D and cold both do? They decrease vibrations on cell membranes. What do we know from physics? Anything that vibrates releases more electrons. What did I tell you before? When we lose electrons, we can't create a battery in water. If we can't create a battery in water, are we losing or gaining energy, Anna? We're losing. Guess what? When you lose energy, what happens to mitochondria? It doesn't become as powerful, so it goes through this heteroplasmy and it slowly builds up over decade, over decade, over decade. So you go from bad vision, myopia, glaucoma, crazy, depressed, Lexapro. Oh, Lexapro's got fluoride in it. It gets worse. Oh, now I have Hashimoto's. Oh, and then I got cancer and I die at 67 years old. And what was the main effect? The percent of heteroplasmy change in mitochondria. Has nothing to do with the DNA, has nothing to do with the genome. See, this is what Doug Wallace is teaching us, and we're not listening. Mm-hmm. Some of us are.
Well, I think we're creating a new tide in medicine. And then again, what's very reassuring is that we have a lot of power as individuals in changing our environment and changing the way we're thinking about it, which brings me to the point of, with this understanding between current, right, our electromagnetic potential and current, and how our thoughts create change. And I know you got to go. My gosh, thank you so much for your time. But when the way we're thinking, and we know how that changes time, how that changes our body and our physiology.
Yeah, it does. I mean, here's the great thing about physics that everybody listening to this should feel good at. As bad as we screw things up, we also have the potential to fix things if we're willing to alter the environment. I mean, I'm a perfect walking example of it. When I was 40 years old, 6'2", 360 pounds, I was a complete asshole, typical neurosurgeon. You would have never heard me talk about any of this stuff at that time. And then when I got my injury on my knee and somebody told me, hey, look, I think I know why this happened to you, my whole world changed. I mean, literally, the rabbit hole I jumped down, not in a million years did I ever think 12 years later I'd be sitting on the internet talking to an OBGYN about this. Not in a million years. And the thing is, this is what makes me passionate now. I can talk about this all day long. I don't want to talk about neurosurgery. You know why? Neurosurgery is kind of like a car mechanic. When you crash your car into the wall, yeah, we can fix that. That's what we should do. But most of the people listening to this have chronic diseases that can't be fixed by the operations that we were taught. Mm-hmm. In fact, they have to be fixed with brain surgery or spine surgery without a scalpel. And that's what we talked about today. We talked about the cosmic wand. The cosmic wand is light. What is it interactive? What's its canvas? Water. What organizes the whole interaction between light and water? Magnetism. Where's magnetism based in? The mitochondria. When you understand how all these things work together, then you create your masterpiece. And that's the only way it can be done. And if you think by taking a supplement, a medicine, a food, prescription is going to get you there faster, you cannot innovate nature, my friend. That is my definition of arrogance. And that's coming from somebody who's pretty arrogant.
Well, I think that you cannot innovate nature is key and is grounding, that we rely on it for everything, honoring our environment, honoring our natural body, right? How we were designed, honoring our natural design and the natural design of what's around us, using that to heal us and keep it as healthy as possible is key.
It's possible. When people tell you it's not possible, that tells me that they haven't thought long enough about how nature really works. I will never tell anybody from this point forward that something's not possible, because I did impossible to me when I didn't think it can be done, and I think you can do it for you too. You just have to decide, are you willing to put the time into you? Are you worth what you should be worth? Only you can make that determination.
I think we all need to say a deep breath, I am worth it, right? I am worth it, because it's not just about us too. It is, first it stems from us, but to our children and their children and their children. And that's the heart of the matter. It's like when I'm out here and we're talking or we're putting this out, and this information is to, heal us, heal our generations that follow us. And when I look at the disease in the children and what's happened in my field, my specialty of obstetrics, and where we've gone wrong, I want to cry. So the more we can get out this information and just, again, recognize our design, honor it, and enable it, right? Heal it.
It's absolutely true.
Thank you for watching this video. Be sure to subscribe to my YouTube channel here and get those notifications, and comment below. Let me know your thoughts, what you loved, and what your action step is.